Are you that person that always feels tight and stiff in the front of your hip and you're always stretching but you get nowhere and it continues to feel tight? Well, this video is for you, so listen up. Every day I hear people complaining about their tight hip flexors. They come into the clinic, they look at me, they say, I always do these certain stretches, but it always feels tight. Well, everyone, we need to think about this a little bit differently, and just because you feel tight doesn't necessarily mean that you need to stretch. So let's dive a little bit deeper into this concept. But before I do, make sure you hit the subscribe button, and if you're enjoying our content, share our channel with your friends. The hip flexor muscle complex is just that. It is complex. It's not just made up of one muscle. So let's go into a little bit about the anatomy so you learn a little bit more as to why you're tight, where your tightness might be coming from, and why it might not just be muscle stiffness contributing to the problem. Our hip flexors are made to basically move our hip up towards our chest as far as we can go. Now, how often do you actually do that movement? Similar when we're in sitting, how often do we ever bring our knee as close as we can to our chest? A lot of the times when you're experiencing hip flexor tightness, we have to look at different factors, including the strength of the hip flexor muscle complex. And as I've already gone over, it's not just simple. It's not just one muscle that is the culprit when it comes to feeling stiff. And also, what we need to remember is stiffness isn't always due to muscle length. It can also have to do with muscle weakness as well. So let's go over a few tests to help you determine where your muscle stiffness is really coming from. Is it a true muscle length problem, or is it more of a strength problem? Now, I'm lucky enough right now because I have this box in a gym facility to do this test on. If you do not have something of this sort in your local vicinity or wherever you are, you can use a couch, you can use a bed, you can use a coffee table, and just kind of make sure that you're in a safe environment to do so. What I'm gonna have you do, go ahead and just lay down on the box, right? I'm gonna have you pull both knees to your chest. One leg you're gonna continue to hold. So I'm gonna go ahead and do this with my left leg up towards my chest. I'm gonna go ahead and drop my hip down, right? The one big thing that I look for sometimes is that there's not a big arch in the back here, and what I'm actually looking for to see is my hip kind of parallel or below the surface that I'm on, right? So the other thing that I'm looking for is how far out your knee is. If I see that you are already showing signs of kind of your knee not being able to bend, I know you might be having a little bit of a quad tightness here, okay? If I see your hip up like this, right, I know that you have a little bit of a hip flexor tightness. So we know that that is actually a muscle length problem. The big thing that you also need to check when you are doing this is your muscle strength. So what can you do? Go ahead, raise your hip up, assisting yourself with your opposite leg, and see how long you can hold it there, right? If you can't get it up there, or say you go ahead and pull it and it drops right down, we know that some of this kind of muscle stiffness you may be experiencing may actually be coming from a lack of strength instead. One of the first ones that I like to give people is simply just making sure that you can move your hip through your full range of motion. If this is a struggle or if there is pain, I do recommend consulting with a healthcare practitioner if it has been going on for a long period of time and if you cannot find that available range of motion. So one of the ones that I like to do, go ahead, put your foot up on a chair, a box, or something of that sort. Lift your knee up towards your chest as far as you can go and just try to hold it there. You can hold for 5 or 6 seconds, repeat it about 10 times, and go through it, say 2 to 3 times on each side. Over time, you'll build some resiliency. If you have to, you can start this exercise from a lower surface if you cannot physically lift your hip from this position. Give it a shot and see how it goes. If you struggle doing this hip flexor exercise in a standing position, you can go ahead and try it in a seated position. Sit kind of with your back supported and go ahead and raise your leg up as high as you can. If you have to, you can help yourself get it to the top and try to hold it there. What I would actually recommend is slowly lowering this and stopping at different points throughout your range of motion. okay? Going and slowly lowering, right? Hit each spot for about 5 seconds and go through this about 10 times. The biggest thing, make sure you're doing it on both sides. Another exercise that I like to add is a banded hip flexion march. So basically, I put a band around my feet, I stand about shoulder width apart, and what I do is I bring one of my legs up towards my chest as far as I can get it. This doesn't only challenge your hip flexors, but it's also a great balance exercise, especially for runners or anybody who is an athlete who does require some single leg stands from time to time. What I actually recommend, say do 10 on each side and repeat this 2 to 3 times and see how it goes. Another exercise that I like to add to strengthen the hip flexors is a long sitting hip flexion. So this is really tough, and at first you may not be able to do it, but what I recommend is trying over and over again to let your body adapt and let your brain catch up a little bit. The first thing you do is basically just sit and try to lift one leg up off the ground, right? So you can see, for me, one side might be a little bit harder than the other, but after you become good at this, we add in some obstacles. Go ahead, lift your leg up and over, something like a kettlebell, and you can do it at various height kettlebell, or with various height kettlebells. So going ahead, lifting over and back, and say do 10 to 15 of them aside and see how it goes. The last exercise that I'm gonna add in regards to strengthening the hip flexors is probably the easiest one out of them all. This can be made harder, but let's go ahead and show you. So what you're gonna do, go ahead, lie on your back, and you're gonna simply bring both legs up. What I'm gonna have you do is try to push one leg, okay, up into your hand. The nice part about this is you can do this at varying angles. The other thing is, if it's too difficult to keep both legs up, you can absolutely put one leg down. So you're just gonna push, right? Bring it up, push, and you can do it a little bit lower as well. As long as your arms are, that's as far as you can get your knee, obviously. So you'll do the opposite side, right? Hold the pushes for about 5 seconds at each angle. And do about 10 of them, okay, on each side, and see how it goes. After you've done all of this strengthening activity and you feel as if you're getting a little bit stronger in those hip flexors, that is actually when I recommend throwing in some stretching activities. So let's go over those next. The next stretch that I'm going to demonstrate is similar to the last one. However, you get yourself in a half kneeling position. So basically what you're focusing on, once again, is not leaning so far forward, right? Yes, I could get a little bit of a stretch here, but I don't feel this as much as if I were to basically tuck my back under, okay? Kind of squeeze my butt a little bit, arms up, and kind of just lean gently into it. I feel a much deeper stretch in the front of my thigh here than if I were to simply just do this, right? So give that a shot, try it both sides. If I'm to show you from the side view, okay, I'll go ahead and put this leg up. Basically, what you'll see, I'm up nice and tall, kind of tucked under a little bit, okay, and my arms go up. And I'm not leaning super far into it, I am just simply kind of pushing my hips forward. Okay, you don't need to put the arms up, you can also do it with your arms right across the chest, but similar to what I said, hold this for say 3 rounds of 30 seconds on each side and see how you do. All right, so the last stretch that I'm gonna give you is actually a repeat of the test that I gave you earlier to determine whether you really did have a muscle length problem. So what you're gonna do, find something sturdy, a box, a couch, a bed, a coffee table, something you feel safe on, and this is what you're gonna do. You're gonna go ahead, okay, lay down. The one thing I want you to make sure is that you are towards the end of that surface. Bring both knees up towards your chest, and what you're actually gonna do is drop one leg down. You'll hold this for about 3 rounds of 30 seconds, but there's also something else you can add to this. So to make it more of an active, contract, and then relax technique, go ahead, bring this opposite leg up and do similar to that exercise I just gave you, where you're pushing one knee away from, basically pushing your knee away from you, okay? And then let it drop back down. So you'll hold that contraction for 5 or 6 seconds and then let your hip relax. The big thing is that you want to make sure your back is flat, and if you feel like your knee's out like this, pull it back a little bit. Get a little bit of a better stretch. If you want to see it on the other side, just like this. All right, and remember, if your leg's up like this, or say your leg's out like this, that does indicate a little bit of a muscle length problem. So some things I want you to take away from this video. Just because you feel tightness in the front of the hip, it doesn't mean that it has to do with a shortened muscle. Sometimes it's actually due to a weakness of that area. So go ahead, give the strengthening exercises a shot, especially if you're somebody who's been stretching for a prolonged period of time with minimal relief in the front of the hip. After you feel like you've gotten a little bit stronger in this area, in this front of the hip area, go ahead and start stretching again. I'm sure you'll notice a little bit of a difference that might just be better for you in the long run.